Yeah. So good evening, everybody. So I welcome you all to this talk show. We are very, very fortunate today. So we have with us Dr. Kavitha Chintala. It's my great fortune to introduce her to you. I'll just read briefly her profile. Dr. Kavitha Chintala, she is a senior consultant interventional pediatric cardiologist at Apollo Health City in Hyderabad. And she obtained her MBBS from GMC, Gandhi Medical College. It's the dream of, I think, every medico. So she completed her residency in pediatrics and fellowship in pediatric cardiology in US. And she's a board certified in pediatrics and pediatrics cardiology from American Academy of Pediatrics. And she's a fellow of the American Academy of Pediatrics, that's FAAP, and American College of Cardiology, FACC, and American Society of Echocardiography, that's FASC. So basically, it's I think it's a dream profile for every person who's in the medical college. And that's not it. This is just one side. And she's also published many peer-reviewed articles in journals. And she's also a regular journal reviewer. The best part is she participates in many medical mission trips globally and also conducts many free medical camps across India. Yeah, and also she's the head of GFESH, called the Global Foundation for Ethics and Spiritual Health. So this is truly bringing about her personality, and her interests include spirituality in medicine, stay tuned, medical ethics, and value education. And above all, Srimad Bhagavad Gita is her constant source of inspiration. So this is, in brief, this is something very in a nutshell about Dr. Kavitha ma'am. I also know her personally. She is such a wonderful person to be with. Very simple, humble, and very powerful at the same time. The kind of social work and contribution that she does, apart from her busy profession, is enormous. And at the same time, the kind of personal life she maintains, the beautiful home she stays in, which she transformed into a beautiful temple, it's truly inspiring for so many of us. So we all look up to ma'am as a great example. And today we are really, really fortunate to have her with us. And I'm sure you all will be really nourished, enriched, and enlightened through this talk. Let us all welcome Dr. Kavitha ma'am. Ma'am, welcome to our show.
Thank you so much, Pallavi. I think that introduction was very, very generous of you. I'm just trying to, do where my heart takes and kind of gradually, trickle to where I am right now. And yes, the spirituality in medicine has been very close to my heart, and I'm happy to, participate in a discussion with you.
Great. Ma'am, so this very concept of spirituality and medicine, for fresher, it sounds very strange. How can these two be married? Can you briefly tell us what exactly, how did it all start at your end? What was your journey into this spirituality?
Yeah, I think there would be like two components. I will first share how I got myself into being spiritual, I could call, and then how I'm trying to link that with my profession. So, as you know, I was born and brought up in Hyderabad, India, and both my sisters are into medical school. So it was something, automatic for me to become a doctor. So I made it to medical school. Then my, next step would be to get into a postgraduate course, and I got into MD Pediatrics in Hyderabad. And then my husband had, I'm going to share a little bit of my personal journey. So then my husband moved to US on a job, so I had to relocate to the United States. And then there I pursued getting into pediatrics, and then went on to do a fellowship in cardiology. Actually, my main intent in going was to do this fellowship because in my internship and medical school, I had seen many patients with cyanotic heart diseases that at that time, this was say 20, 25 years ago, they were not getting any medical care. So I'd seen a lot of blue babies, come to the emergency room, and we had no proper treatment, and they would all succumb to the disease. So my intent was to, get proper formal training in pediatric cardiology. At that time, we did not have fellowships in India. So that's when I went to the US, and I completed my fellowship, and then I stayed on to do, take a job there at Wayne State University, Michigan. And then, so I had at that point a job, then my husband was in a good job. Then we, it was like a American dream at that time, and we all bought a home. And so everything at that time was, perfect. So in school, it was always getting good marks and excelling in your school. And then getting into medicine was a dream come true. And, it was like everyone in my family was doctors. And then going to America was a dream which happened for me. And then pediatric cardiology fellowship wasn't easy getting it, but I got it, and then settled down. So at that time, I think there was a point where I was still searching for what next. So the question that arose at that time was, Pallavi, there's somebody that's unmuted. Yeah. So at that time, it was, what next? What was the next step for me was this big question. And I think, you guys are all young in your life, and it's always good to pursue your dreams. I'm not saying that that's not okay, but once you've reached that point where you've acquired these, material degrees and things in life, then the question came of, what is next for me? So this question was bothering me for some time, and then I started questioning the bigger purpose of, life. What is life for me, or rather, why am I here, and what is my next step? So I kind of internally was trying to get my answers, and could not get it. So there was I would say it was not a disturbance, but some void was there. So I was trying to look into answers of, on a bigger scale, why, what is the purpose of life, and why we are all here, and what is my next responsibility to do. And at that time, fortunately, I met someone. His name is His Grace Yugal Kishore Das, and he was from the temple, a monk, and in fact, he was a professional himself. And then he went through his journey, his internal journey, and became a monk. And then that's when I met him and attended a lot of courses, like, some of you did the Discover Yourself courses, and then went on to read, the Bhagavad Gita and Bhagavatam. So that's how I came across spirituality. And fortunately for me, when I started reading the Gita, all the answers, came together. It was like fitting pieces of puzzle together. And at that time, I could, because all the answers were there, and then it kind of made sense. The whole, my, being a doctor and pursuing the medicine, and then plus this spirituality that I could integrate, and then that gave really opened a whole different world for me. And then it's an integrated life for me. It's more complete for me. It's more wholesome. So now I don't have, these questions of, what is next for me, or, what is my goal in life. So most of those questions were answered. So now that gave me a lot of inner peace. And then I was reflecting on, how that should, affect my, my professional life. And that is my, personal spirituality. And then as I'm progressing in life, I'm doing the regular medical healthcare and seeing patients and everything. And then I'm thinking of, how, because I found this, what I want to call, I would call it a nectar. I found something that's very precious, that gave me, an inner meaning and a purpose. And it's always that, you want to share this with other people. And that's what we are trying to do today. Sort of, I want to share my journey of, happiness with all of you. And then it's also very important that, we being in this profession of medicine, we'll have to see how, this will be integrated into medicine. And as you pointed out, Pallavi, it's very common, like, on a general day-to-day hospital work, we are so busy, taking care of the physical aspect of illness that, we tend to forget that, there's a person behind it. There's a person who, has a heart and a mind, and a soul behind it. So I think medicine in some way has become very, I would want to say body medicine. And that's I'm afraid that, we are moving towards the wrong concept of medicine. I think in the past we were more holistic, and now somehow, because I think the disease is so much more and the doctors are less, we just have time to address the physical aspect. So we see the patient as somebody that has some organ dysfunction, and then we are writing a bunch of medicine and sending. So that wasn't, that's in fact not the definition of medicine. So I think we all have to understand that, health is actually, the WHO defines health as not just absence of disease, it's a social, physical, and mental well-being. And actually they've added even, not the WHO, but many people want to add the spiritual aspect to it, because spirituality is a integral part of health. Now many organizations, including, the American Academy of Medicine physicians, they've all agreed that, spirituality is an integral part of healthcare. So that's how I'm trying to link, and then trying to read a little bit about this, and I find now that, it has huge implications for healthcare as well. So if you want me to, if you want me to go into details of how actually it affects healthcare, I can do that. So there are two aspects of how, spirituality affects health. One is, again, there's a lot of literature published. We typically don't look at these publications. In general, again, we are reading about the disease. So then I had an opportunity when I was doing conference for this Global Foundation of Ethical and Spiritual Health, that we were trying to address and connect spirituality with medicine. So I did some of the research, and there's a lot of publications also on spirituality. And surprisingly, most of them come from the West. Even though I think East, India is a hub of spirituality, but I think we've kind of lost it. We don't do a lot of research on this, and we've kind of gave up on that aspect of life. But research tells, actually surprising to find that, people who are spiritual, and then there are different definitions of spirituality, but people who are spiritual, their lifespan is actually greater. They live greater by, an average of 7 years. So that took me by surprise. And then there are many good effects of somebody who's spiritual. So there's research done that looked at patients without spirituality and patients with spirituality, and they find out that not only the life expectancy, but they all have improved health. They all have less illnesses, and this is all scientific research. I'm not just sharing anecdotes. And then they've also noticed that people who have this religious struggle, quote unquote, they're still struggling about whether God is there, whether there's a higher power, or we're just bodies that are going to perish. So people who have religious struggles, they have actually noticed that their mortality is higher. So everybody, I think, needs to, whether it's a patient or not, needs to have that greater understanding of some connection. You may call it with the self, you may call it with God, you may call it with nature. So they're all different definitions of spirituality, but I think people need to have that, and that gives a sense of calm and peace, and that has been less stressful. Definitely, they're all less stressful. So these have all been linked to staying healthier. In fact, there are now researchers, that are even showing people who are spiritual, and say people who are doing meditation, yoga, they also have changes at the genetic level. So that's how deep, spirituality can affect your health. And another interesting paper I found is that people who are spiritual, their interleukin-6 levels are lower. Now, we all know that interleukin-6 levels are associated with higher mortality. So these people have less interleukin-6. And then not only just, being healthy, now these people, if they become sick also, their coping mechanisms are much better than, people who are not spiritual. And we see this all the time. We see people suffering from cancer, where some of them, have a lot of disturbances, and some of them take it well. And it all depends on, how internally spiritual you are. So it's a very, very important mechanism, spirituality, of coping with disease. And they also say that being spiritual also helps with pain, and a lot of this data that says that the most common non-drug we use to address pain is prayer. So prayer has been shown very positively to be helpful in patients suffering from chronic illnesses and painful illnesses. So this is all data about how spirituality links with health. And another aspect I want to address at this point is not only that, this is all about, how it affects the patients, but then there's a whole concept of, why doctors should be spiritual also. Because so two ways how spirituality is affecting health. One is what is doing to the patient, which I just addressed, meaning, there's improved mortality, there's improved morbidity, there is less stress, there is better coping, there is less disease. So these are all the patient aspects. Then there's a doctor aspect of spirituality where, we all also have to be spiritual. We all actually need to be trained in spirituality, because it helps a lot in understanding the patient's disease. So you have to put the disease of a patient, in the context of his life, in the context of his social situation, economic situation, psychological situation, and spiritual situation. Otherwise, it becomes a very isolated, again, what I would say, a bodily medicine. And so it is very important that we understand this about as a wholesome patient. And then we should also will get a better understanding of the dynamics of the disease, because many times, as you're all familiar, and you will become familiar, a lot of presentations in the outpatient, actually there's a study that says about 60 to 90% of outpatient visits are related to stress. So, I mean, there could be some physical disease also, but because of the stress, it is all amplified. So many patients come with a lot of psychosomatic complaints. The extreme form is like, somatization disorder, it's called. So they actually have bodily pains. They come with chest pain, they come with gastric problems, they come with constipation. So a lot of these are psychosomatic. So I think understanding, that person's spirituality or your own spirituality will help us understand the disease better. And then another important aspect of why we should, as doctors, be involved in spirituality is that, especially, in acute care settings, or what I would say end of life settings, where patients have to make decisions. Every patient needs to make a decision about how long to prolong their life, and situations like that, spirituality becomes a very, very vital component, because the decisions they are taking, not only end of life, even through their medical care, patients take some decisions, and understanding their underlying spirituality will make us understand better of why, that patient took that particular decision. Otherwise, it sometimes gets very difficult. And then, as I said, it is a holistic way of looking at the patient. And then we also know that when you inquire into their spiritual aspects or social aspect, that builds a bond between the doctor and patient. So it really improves the patient-doctor relationship. So the list is very long, but these are all the benefits of, why spirituality should be practiced by a doctor, and then how spirituality links to healthcare. Yes, Pallavi.
Wow, that's really a lot of details. I think we should have a seminar based on this topic. And the statistics are really alarming that the life expectancy is increased by 7 years for those who have been seen to practice some kind of spirituality. That's very interesting. And so, ma'am, yeah, you've spoken so much about what is the role of spirituality in medicine. So my next question would be, uh, so since you've spoken with so much of scientific research and data authentically, that how spirituality does have a role in the medical profession. So do you think there is a need for incorporating spirituality into formal medical training, and how can this be done?
Yes, absolutely. Even the more I'm looking at the data, the more I feel the need, and for the reasons I just listed out, it's very important. Unfortunately, that's not the case. And I think over time, we've just become, these doctors who address just the pain, and we've become, this reflex doctors, or, somebody says, just like, you have somebody says you have fever, you give a paracetamol that will take care of the fever, but you need to understand, why the underlying fever is there. So similarly, when disease comes, it is a manifestation of just not the body. It is a manifestation of, an imbalance in the mind. It could be an imbalance in the environment, their lifestyle, their psychological events in their life, their relationship issues. So it's a manifestation of many things. So we have to start looking of disease as a whole. I would want to say, look at the patient or a disease as disease of the mind, body, and soul, and they all have a big interplay. It's I mean, sometimes it's just disease of the body, but many times there's a lot of interaction happening. And so to understand all this, I think it's very important for, you know, young people like you that are training to have spirituality as an integral part of your training. And there are some programs, actually many programs in United States do that. They have spiritual training as part of their curriculum in their medical school. I think they do it in their 4th year or 5th year, and they have formal trainings. Again, don't get confused by, you know, spirituality or religion. They are two different aspects. Spirituality, I mean, it has a relation with religion, but it is not religion. So spirituality is our, you know, our inner sense of being, or our inner sense of what our purpose in life is. I would say there are many definitions of spirituality, but I think comes close to that. And it is also appropriate to say that, you know, the spiritual health is that which is not addressed by the physical, social, and mental well-being. So there are some issues that are outside of these three, and that is what is spiritual health, and it is part of, you know, the overall health. It's very important for young physicians like you to understand and train. And like I said, in the United States there are programs that are doing, and unfortunately in India we don't have any formal training. Although, like I said, you know, we are very deep rooted. Our India's USP or unique selling proposition is spirituality, but then we have somehow disconnected it from medicine. And there is, I want to say that there is some kind of resistance also in doing. I've tried, because I think there's a lot of confusion when we say spirituality. People think it is religion, and then there's this, you know, religion psychosis, or I should say religion phobia in India, because they just don't want to, you know, they don't want to address that. I've tried it, you know, with places I work also, and the moment we say spirituality, they jump to, oh, is it going to be religious? And, you know, we have multi-religious people. No, spirituality doesn't have to be religious. You know, a person can be very deeply spiritual, means he can have a very deep connection with, you may call it God or higher power or nature for that matter, or your own inner self, your connection. That is also spirituality. Now, religion is, again, I'm not shunning religion. Religion is like a manifestation of spirituality. You know, the example once, you know, one of my mentors gave is very nice. He said, suppose, you know, you love somebody, okay, you love your mother, and to express your love, you will probably, you know, go and give her a gift. Okay, so so that gift is a manifestation of your love. The gift itself has no value. Like, you know, your mother could buy 101 saris or whatever, but because you gave it to her out of love, then that becomes, you know, a real gift. So religion is like that. So when you start loving God, then the expression of that love has to be in some form. Again, you know, they say love has to be expressed. It's not enough. Like, you know, you can't keep telling your spouse that, you know, you love him and not cook for him or feed him. So that love has to have a manifestation outside. So just like that, if you love God, you know, there has to be a manifestation. So you want to do some service to him. You know, you may want to cook for him, you may want to worship him, you may want to offer a song to him. So anything. So those manifestations, I would like to call it religion, and different people have, you know, different ways to express their love to God, and that is all okay. So what we are discussing is, you know, spirituality. So we'll keep that religion aside, but there's a lot of confusion and phobia, and that's why I think that's a big barrier as far as India is concerned, why they don't want to take spirituality into the medical arena. But again, the US is less confused. And then the other issue, why we are not doing it, is probably lack of time. Again, in India, we deal with a lot of patients, you know, per day. What the doctor-patient ratio is very high in India as compared to the West. So we don't have that kind of dedicated time. And I also want to say it's a lot of, you know, unfamiliarity with spirituality. So we have, I mean, the medicos have not been exposed to it. Neither, you know, maybe at home. Again, you know, Indian homes are religious, but I don't know how spiritual they are, and we don't have formal training, especially, you know, the Bhagavad Gita, which is the essence of all our spirituality. That exposure to the Gita is not there. And so, you know, without having the adequate knowledge, it's difficult to, you know, counsel a patient. And then also there's some hesitation about, you know, will I violate the patient's privacy, things like that. So these are all some of the barriers. But yes, definitely I would advocate that, you know, this be you know, incorporate into the curriculum. And you know, I've in between, you know, tried talking to people about this, but again, you know, at this point it's not very welcome, and they're, because of all these barriers. And I think collectively, we can all do to make this happen. And then only I think I see medicine becoming holistic. Otherwise, it will just remain, very on the bodily platform, only on the physical platform. So I see a great need for that.
Ma'am, you've shared with us some amazing concepts. I mean, I think these are the seeds for a great future of tomorrow. I mean, I think if we take your words seriously and walk in the direction that you're just showing, I'm sure the medicine is really going to be the holistic one that I'm sure that you dreamt of, that you actually envisioned. So I'm very happy that we are having this talk show here today, and I'm sure this is going to help many, many. So, when we speak about spirituality, it requires investment of a lot of consciousness into it. Yeah, a lot of energy into it. So my question is, ma'am, like as such, for medicos, like most of the students who are attending here are in the first year of medicine. So MBBS, it's a very rigorous schedule, the kind of schedules you follow. Can academic excellence and pursuing a spiritual path, can these both go together? Or one will
It's a
disturb the
very
other?
very, very appropriate question. I get asked a lot. I think spirituality and professional training or job should be taken as complementary, not exclusive of each other, because one is going to help the other. Now, it's like, at this time, you will think that, you may be spending some time that is not your regular academic work. But let me tell you, in the long run, it's going to, return the investment. So it's like an investment you do now, and that's going to give you returns later. So that's how you should see it as. So this investment of time that you're going to do, time and energy into spirituality, is going to pay you off, because there will come a point, in life when all this chasing of career and all, like what happened with me, you'll be having, questions of, where you're headed. So I think to have a very clear path of your academics and a clear path of your life, it is very, very essential to have some form of spirituality. And I'm not saying you'll have to do this or do that, but look at, take time, look at your own self, and see what you connect with. Some people connect with themselves by doing yoga, some people connect by doing meditation, some people just sitting quietly for 10 minutes, some people take nature walks. So it's anything, because this is a connection with nature, with yourself, with God, and with higher power. So that has to come, and it'll make you an overall, again, I would say, holistic personality. It's going to add so much value to your life, and so much value to your relationships, and also so much value to how you are as a person, and how you will be as a doctor. Again, it's very important. We see everybody gets trained similarly, right? Like when you're in medicine, or when you're doing internal medicine or something, the training that is given to everybody is similar. I mean, we all read the same chapters, we all do the same exam, but one doctor becomes very famous or very popular, or very he's wanted, whereas some don't do that well. So I think, apart from business aspects, what makes you a good doctor is that connection with the patient. The patient comes to you when he's in distress. Nobody healthy is going to come to you. So when somebody is in distress because of ill health, or other ancillary things, psychosocial things happening in their life, there are only two places they're going to go. One is God, and one is you. One is the doctor. So you have a very vital role to play. So it's literally like that patient is coming and putting your health and his life in your hands, and then you have to have that balanced outlook of providing for this patient. And that so you're on the giving side. As a doctor, like we say, it's a noble profession, it's a sacred profession. Yes, for a reason, because you are responsible for that patient. Again, not, I would say, for the person, not just the disease, but you become responsible for that person. So your inner depth has to be so much that not only are you handling your family, your education, but then you have here many patients coming, and depending on you for their existence. I want to say, maybe a little excess word, but that's what it is. So I think you'll have to do this investment. And not only for the patient, but for you yourself. Because again, medicine, whatever you say, it's a very stressful, even during the training, and even as you practice, it never gets, you'll never probably, sit back and relax, because again, you have new diseases, you have to keep yourself abreast with the ongoing research, you have stresses, especially if you're doing things like, acute care in the ICU. So it's a stressful job. So, and then you'll have your, your maybe your married life, your children will come, your parents may need attention. So it becomes a very dynamic lifestyle for you. And in order to balance all that, you need to be first, internally balanced. And I think that balance, that peace is given by, spirituality. So it's worthwhile, spending a half an hour or 1 hour on this is again, on your own self. So you're building yourself inwardly, so looking internally. So I think that's very important for everybody, to not just our profession, but in general. I think everybody should have that time out for recognizing, who they are, and it just adds a whole lot of meaning to your own life. Plus, when you interact with patients. So yeah, that time it's busy, but I think again, what I realized when I was new to this bhakti and devotional service, even I kind of thought, I'm such a busy person, how am I going to do this? Or, I will not be able to do this. But then when I started doing it, it gave me so much of peace and meaning that, it became an automatic process for me. And time wise also, somehow, they say if you take one step towards God, or, Krishna, I would want to call my God is Krishna. So if you take one step towards him, he's going to take 10 steps towards you. So I realized that by giving a little time for this devotional activity, I got a lot of time. So maybe I took out the unnecessary things in my life, maybe, chatting with friends or watching TV, or, just some of those elements that are not really necessary, that are not building your own self. So I was able to replace those with, a more meaningful lifestyle, I would want to say. So time will come. You just need to have that inclination, that desire, I would say, and then the rest will be taken care of.
That's really wonderful, ma'am. I mean, as you said, unless you cannot give what we do not have. So unless we develop a holistic life, we cannot translate that into our profession. So it's very important that we personally ourselves grow, experience it, I mean, what is holistic life? And that requires we start young, we start early, and begin from the right from the early age. And it's an intelligent investment. What ma'am is saying is it's an intelligent investment. And in the process, we get rid of many things that are not necessary and which don't really help in building one's inner self. So that's really directional. So, ma'am, now we're really keen and interested to know that you're really such a busy person, uh, at the professional front, and also you have a beautiful family to run. For all of you, Madam is the mother of 3 wonderful children, and I know her daughter. Her daughter is an amazing classical dancer. She has such grace in her dancing. I'm a fan of ma'am's daughter. So, I'm keen to know, what is your daily routine like? So how do you fit all these elements into your day? Can you kindly
Yeah,
share with us?
sure. Yeah. Again, it comes by practice, and that commitment, I would want to say. So my day starts, I wake up around 4:30, and 5 to 7, after my morning freshening and all, bath and all, I do, my way of, being spiritual or connecting to that higher self is what I call the mantra meditation, or japa. So I do this Hare Krishna Maha Mantra, and we do it, we have rounds, 108 times. Chanting on the japa beads is 1 round, and we do 16 of those. And that's because, I made a vow to my spiritual master, who's my teacher in spirituality, and we all need, that also. Just like we need a teacher for anatomy, teacher for biochemistry, we need a teacher who teaches you spirituality, and that's who is my guru, I want to call. And so our morning 2 hours I spend in this is called japa, is called mantra meditation. Means it has that meditation aspect where you're sitting in one place and internalizing, or being calm. And then we do japa is the Hare Krishna Mahamantra, Hare Krishna, Hare Krishna, Krishna Krishna, Hare Hare, Hare Rama, Rama Rama, Hare Hare. Now there are many mantras, but this is considered Mahamantra in our scriptures if you look at. And they say for this yuga, which we are in Kali Yuga, it's enough to do this because we cannot do what was prescribed for other yugas, like go meditate on Himalayas or do elaborate fire sacrifices and also it's what is recommended for this time that we are living in. So we do that, and that has given me, it's like, I want to call it, it's like an internal bath. Just like you would use soap and water to wash your body from externally, so every day all of us have to do that. It's external cleansing goes on, and shastras say that that internal cleansing also have to happen, because internal cleansing is to do with the soul. So our soul also inherently it's very pure, but because we are in this world which is a lot of contamination and lot of we are bombarded with a lot of sensory stimulation, then it's kind of covered. So it needs to be cleaned on an everyday basis, and this japa, that's what it does. And actually mantra means, man means mind and tra means to deliver. So what mantra does is to deliver your mind. Just like in Sanskrit you say putra. Putra means son who delivers their parents. So tra is for delivery and putra means son. So just like that mantra, so it delivers your mind. What does delivering your mind means? Again, Bhagavad Gita, Arjuna says a lot in couple places that it's very, very hard to control your mind for everybody. I think we get more than 60,000 thoughts in our mind every day, and it's very difficult to control your mind. And mantra is one efficient way of controlling your mind and getting it under your control, rather than you being controlled by the mind. You have to have mind under your control using your intelligence. So that is what is recommended in the Bhagavad Gita and other shastras. So that is one activity I do in the morning. And then I have beautiful Radha Krishna deities, and then so I serve them in the morning, in the sense we wake them up and offer them breakfast or lunch or whatever, and then I do an everyday aarti. And then most of the times I leave for work around 9. Some days if I'm in the cath lab it's a little earlier, so some days I have to leave at 8 and some days I leave at 10. So it's a little flexible for me depending on what my daily schedule is, and I adjust the morning according to that. So if I have to go very early, sometimes the japa I do half of it in the evening, but then I have to do my prescribed rounds, so I never miss on those. And then work I come back around 5 or 6, and then my regular giving time for family, with kids, and all that. And I typically have a lot of carryover of checking the emails or doing some research, and I do that in the night after my kids sleep. So I maybe go to bed around 11. Some days it's 12 also. So that's my typical schedule. And over the weekend, where we get a little more time, then that's more time for the family. So that's my typical daily routine.
So I'm sure none of us should have a complaint that I don't have time for spirituality. So because I mean, I can't imagine a timetable like this where I have to sleep at around 11, 12 in the night and wake up early in the morning 4:30. But
I mean,
I'm
I'm
sure.
not trying to scare. I'm not trying to scare anybody because I'm a mother. I have 3 children. I have a home to take care. So all that gets additional. But the young ones, youngsters like you, your main focus should be doing your academics and just spare like maybe half an hour on some form of spirituality you want to invest on. That's what I'm saying. Yeah, as you grow in your life will determine how much of added responsibility that is. But I do this very happily. No complaints or no grudges about anything.
Oh, we're just beginning to appreciate that. I mean, the kind of determination that you have to have such a wonderful morning, the morning schedule that has been set up. It is said that whatever we tune into morning, the same thing continues throughout the day. So your morning is exclusively filled with such amazing activities where the consciousness is totally uplifted to a higher level to carry out throughout the day. And ma'am, I'm also glad to say that many girls who are present here, they're also joining the morning program, and they've also started chanting. Some of the
Okay,
girls from
wonderful,
SVU Medical College.
wonderful, wonderful.
So your words of inspiration will further instill this faith in them.
Oh, the girls have you as a great guide, so I'm very happy for them.
Trying to share whatever I have received. So, so ma'am, you were telling about this chanting. So how does this chanting, the process of mantra meditation, how does it help you in your overall effectiveness in the other
Yeah,
activities? Does
right. Like I said, chanting is a form of meditation and also a vibration. Now, I've also looked into, some of the, I was interested in looking into, there's a lot of research also that happened on meditation. I'm sure, all of you must have come across. So meditation has a lot of health benefits also. It reduces stress. It makes your mind calm. It makes you very focused. It helps you in decision making. And again, even doing this meditation has been shown to have, changes in your chemical milieu of your body, like up to the level of genetic modification. So even meditation can do your genetic modification and change in all these, neurochemical parameters. So a lot of benefits have been shown by meditation, very scientifically proven. And adding mantra is like, it's a sound vibration. Again, there's a lot of benefits to sound also on your body. Interestingly, I was looking at some data. They take water, just plain water in containers, and then they expose that water to different kinds of music, like symphony, a Sanskrit verse, or a Japanese prayer. So they've exposed the water to all these kind of music, and then they check the water molecules under the microscope, and they all have, I wish I had a slide, they all rearrange. So the molecules all rearrange to become very flowery. So they've shown that which is a very a peaceful mantra or a prayer kind of a music, the molecule becomes like a flower. Whereas if you expose it to very hard rock or band, the one, then it's all disintegrated, the crystals will all disintegrate. So sound has been shown to have a lot of effects on your body, because your body is also made of 70% water. So if the sound is doing this to an external molecule of water, what it does to you internally. So again, sound has been shown to have positive benefits depending on what kind of sound you're listening. And they say that actually the cosmos has a lot of vibrations, which are sound vibrations, and that on a day-to-day basis we are not able to hear because of so much noise around us and within the mind. So we are not able to relate to it. Now when rishis gave us mantras in the ancient history, those mantras, I believe, are replicating the sounds of cosmos, and that's why they have such good effects on your brain. And interestingly, the Hare Krishna Maha Mantra that we do has been shown now. Scientists are looking into all effects. In fact, Om, just the mantra Om can do a lot of neuromodulation in your brain. And recently, I came across one study that looked at Hare Krishna Maha Mantra effect on the brain. So they're doing MRI of the brain, or your nuclear imaging of the brain, and on a basal level, when you're not doing anything, also there's a lot of neurochemical activity going on in the brain, because our brain is practically never at rest. And half an hour of Hare Krishna mantra, when they did, there's a lot of that neurochemical activity came down. So it shows, I mean, it's a positive scientific study that shows the effect of Hare Krishna mantra in calming your brain. So not only the decreased activity of brain is there, but the good, I mean, I can't go into all the brain research, but the good parts of the brain get stimulated, and then the noise in the brain also decreases. So that is an effect of sound. So the reason I like what we do japa is because it gives us benefits of both the meditation and the mantra vibration, so the sound vibration. So that is a benefit of japa. I'm sorry, I forgot the original question. What was you asked me?
oh, ma'am, it's quite related. It's about I was asking you
How
about how.
chanting helps, right. So this helps you in focus. So it really helps me in focusing my day better. And like Pallavi said, if my morning goes well, the rest of the day I carry that positive vibrations with me, and the day typically goes well. If any day I'm not able, for some reason, some social thing happens and I'm not able to do, then I mean, one thing it's there that I have to do this, but then the day doesn't seem so well. So it definitely improves your, what we call, consciousness. Now we all have to also understand the concept of consciousness and your modes. So you're in mode of goodness or passion or ignorance in different parts of the day, and the morning is supposed to be a mode of goodness. It's a good time to do these spiritual activities, and then that mood will stay on with you. So it improves my mood in the morning. It helps me to focus, and it also improves the energy. And so I think for me it has been a positive effect. And not only this, it has internally changed me so much. I think, again, in your classes you may have heard, like, we all have a lot of anarthas, or disqualifications in our heart. It could be envy, it could be greed, it could be lust, it could be jealousy, and desires for a lot of material things. And all those, everybody, all of us are living with those, and this mantra has helped us to remove those. Again, like I said, it's a purification of your soul. So when you do this, all these have come out. I mean, it's a process for everybody. We are all in that process. I mean, by no means saying I'm pure hearted or anything, but it has helped me to introspect on a lot of these, and probably as a person become better. And that is also very important for especially also doctors, because compassion and empathy has to be an integral part of practicing medicine. So once you modify yourself, or you clean yourself internally, then you start seeing your world as a different place, or the world as one. So you will not discriminate between something that is mine and something that is his. So a lot of values also. So an added advantage of this morning japa is that it improves your lot of values that are very essential for your building, whether it's a relationship in your family or a relationship with your patient. It all helps. So there's a lot of benefits of this chanting for me. And it has really, of course, it's a process. All of us have to keep on purifying us more, but it has helped a lot in my handling the patients also.
That's really amazing, ma'am, the kind of data that you have given. I mean, I wish we could take a look at those, the slides, how these
Yeah, I
moleculars
can.
have arranged themselves into these beautiful flowers. And
I'll post. I'll send them to you.
yes, and the whole concept of having an internal bath, as against the external bath, which we tend to focus on. And that's really amazing, the kind of comparison that you've made. So, so then, so how do you actually balance your spiritual life with your personal and professional life? So there are three. People find it hard to balance these two, the personal and the professional life. And here is another life called the spiritual life. So how do you balance these three?
Yeah. See, I think all of us have to kind of, sit down. We go into these, cycles of doing some here, some there, everywhere, and get stressed out. I think stress also becomes an integral part of everybody. We all have to, stop in our, I would say, we are always running for something, running to the next goal or next goal. So we all have to stop and take everything around us into account. And then for our life, and again, it's very different for different people depending on what is going on in their life. And you have to stop and kind of make a plan for life, I would say. Not just because a lot of the time we just do things as they come. I mean, of course we have some goals, but we never kind of sit back and assess our lives as such. So we have to do that. And then everybody, see, work is important, but everybody has to have their time in the day allocated to different pockets. And work is one big pocket, family is one, personal is one, and spiritual is also one. So of course personal and spiritual you can merge together, but so everybody needs to give time for their academics or work or profession. And then the number of hours you want to give depends on what your profession is. And then everybody needs to give some personal time. Again, I've seen that personal time, and then everybody has to not, sorry, a family time, and then everybody needs to give a personal time. And in your personal time, your own personal development could be just sitting in one place on your own, spending some quality me time, just introspecting into the day. And then your spirituality can be a part of that personal time. And everybody needs that, because very often we see, again, especially, women who are working and taking care of home, they're always running between work and kids and home, and then they never have that personal time. I think in the long run that is not good. They're just going to be so burned out, and a burned out mom will become less efficient. So again, don't especially in the Indian context, I see a lot of mothers, I've seen my mother too, they're always giving, right? They're working here, working there, and always giving, and they never find time for themselves. I think that seemingly, some people think it is selfish, but it's not. You have to, slow down and take some time, even if it means 20 minutes, just go out where there's nobody and give it your time, because that is a time when you develop internally. You assess everything in your life. You'll be able to make some decisions. You'll be able to make some choices, and all that will be good for your family and for your work. So rather than running, between chores and not stopping, this is better. Even though you're spending, 20 minutes away from your family, it helps you to, reassess your life. So I think everybody needs to put that, and I put, my spiritual practice into that pocket. I mean, I make it clear for my family that, this is my time. I mean, if yes, those 1.5 hours I'm not available to them, but I tell them, that's my time with God. Of course, I do it in the morning when nobody wakes up. That helps. But that's my time. That's my time for connecting with who I love. So something like that. And then family time absolutely has to be there, because again, I've seen, especially those who are husband, wife, are doctors. I mean, he's doing his profession, she's doing his profession. When they come home, they're talking work again, and never have that bonding time. That's also very important. Family time, whether you have kids, or you're just married, or you're unmarried and you're living with your parents, that family time is also very important. Because end of the day, you could be a very successful doctor, but if you don't have that family bonding and family relationship, it's going to consume you. Because end of the day, when you're sick or you're retired, it's your family who's going to be there for you and take care of you. The work will not. So I want all of you to take academics seriously, pursue your goals, but work is not the end all be all of life. So don't spend 24 hours of your life into work and then miss out on the little things. Question yourself, how long has it been when you walked out there and appreciated the sun? How long has it been there when at 7 o'clock in the night you went up and looked at the moon? How long has it been since you appreciated a flower and the the nectar on the flower, or the morning dewdrops on the flower? So all these are very, very important in life, because I think we are missing out a lot on that. And especially so-called professionals, all of us are just running, and I just so in my life also, especially when I was in US, my life was very busy. So there it's a very long hours. I used to leave at 7, come back at 7. Then in that little time I have, take care of kids, take care of my devotional service, cook, clean, everything. So it was very stressful, and then over time it'll get to you. So don't let that happen. Then you have to sit and say, some things you may have to exclude in your life. So at work you have this big requirement, but it's consuming all your time. You have no time for your family, no time personally. Then it's okay to let go of some things. Yes, you may not be as popular as your colleague, but that's okay. Again, many people won't openly say something like that, but I don't mind, because don't run after popularity or even money. I would say just live your life fully. Live your life fully and meaningfully. It is okay if somebody, your colleague writes 10 research papers and he gets very popular, or he gets invited to 10 conferences and you get invited to 5. That's okay. But it's not about comparison at all. Or if your friend got distinction in anatomy and you didn't get, that's okay. Everybody has their own capacity. But so within your capacity and within your environment, you do your best. But I would really give time to each of your aspects in life, because life is more than just work. So I mean, that's how I try to balance. I may not be considered very productive in work, but that's okay. That's whatever is in my capacity, I do it, and so far that's what I've been doing. So I may not be 100% right, but that's what I did in my life. Back off a little bit, because I was also at one point very aggressive at work. I wanted to do a lot of things in work, then I realized, it's taking away, time from many other aspects of my life. So maybe now maybe it's my age also. I've sort of, slowed down a little bit and doing other things. And that's how I'm, looking into spirituality, reading the Shastras and all this. So it's giving me, the joy that I wanted.
I think this is the essence of life in a nutshell, and about appreciating the dew drop on the petal of a flower. For all of you who do not know, ma'am is a great writer. Ma'am, really looking forward that you would produce something and for all of us to read and enjoy. So you also have a poet in your, I mean, in your heart. So you should start writing. So it's amazing. I mean, the kind of very, very practical points that you have told us, that do not chase after, name, fame, and the power. It's a mad chase. I mean, if we are into it, we really miss out on the most essentials, and most of the time we burn out in the process.
Yeah,
And
life has become like that, very competitive, even, in the medical field, very competitive. So don't get into that race. You don't have to race with anybody, I would say. You're your own, judge. So if you improve based on yourself. So if you did something today, maybe next year you aim at doing a little bit better above yourself. It should never be, you should beat the guy next to you. So I think that's the attitude. If we develop, there'll be less stress in life.
yeah,
And this concept, I also want to tell you one, if I may. Again, practicing medicine can be stressful because we deal with life and death. So I also want to, or maybe we'll talk about this later. Yeah, go ahead, ask.
yes, and also you told us so wonderfully about the other side of the coin, wherein uh, a regular housewife in the Indian scenario, how she burns out herself in the process of giving. So how important it is to give yourself your own time. And you have so wonderfully shared with us that your time is the time that you spend in spirituality, which actually nourishes. So that's an amazing plan. I mean, very well planned life on a day-to-day basis, and with a wonderful long-term goal in the vision. So, as in your introduction, we have learned that you're an ardent admirer and practitioner of the concepts of Gita. So, can you please share with us that what are some concepts of Gita, Bhagavad Gita, that you apply in your profession? And how does it also help in your interpersonal relationships at your professional?
Yeah. So again, a lot to be said about the Gita, and we all know that, that's probably the cream of all the Upanishads that is out there. So for those in the forum, you may not have time to read everything, but Bhagavad Gita is like our, I would want to say, manual for life. So everybody should read that. And there's so much of information in Bhagavad Gita, so much you can apply to everybody's life, no matter what you are or where you are in life. So I've also learned some very important points in Bhagavad Gita that I could apply in my profession. So again, the whole book is a manual, so obviously there's going to be so much to be shared, but I just want to share like 3 or 4 important points in the Gita that has helped me. One is, it has made me understood, again, reading chapter 2, which is the Gita summarized, which talks about the soul and the body. It has made me understand what the source of life is, because in all of the medical reading we did, we don't understand. Again, we read it on a very physical platform. So if you want to say, suppose you want to say we are alive because the heart is beating. That's a medical concept, or the brain is working. The heart is beating because you have a pacemaker, and the pacemaker is located in the sinus node, and it has electrical impulses that are auto-generated, and then those impulses make your heart beat and the blood circulation, and then we are alive. So that's a very physical aspect. And then nobody in medicine defines why the sinus node fires on its own. It is a pacemaker, yes, but what is making the pacemaker fire on its own? They say, yeah, there's a sodium potassium pump, and yes, but where does the sodium potassium pump come from? So where are the genes coming from? So we've dissected the body. We looked at the microscopic aspect of the body. We looked at the genes of the body. But can we answer where the genes came from? Can we answer where the pacemaker cells came from? Can we answer how sodium potassium came in our body? So really we don't have answers for all of this. So I went through medicine again, not questioning this. This question came to me very late in my life. So now I realize after reading the Gita that that which pervades our body is the consciousness, and this consciousness is determined by the presence of soul. Again, the whole reading chapter 2 has given me so much understanding of how everybody has a soul in them, which is a part and parcel of the super soul, which is the God, and then that is what is keeping us conscious. So again, Shastra refers to this term consciousness. So when you don't have consciousness in your body, that means when your soul is separated from your body, then you're a dead body. So that consciousness that is pervading the entire body is because of the soul. So this is a very basic concept I understood and I could apply to why a person is living and why a person is dead, which is again very, very important. And this has also helped us understand about death. Just like about birth we understand from the Gita, we also understand about death. So what is death? Again, in a medical terms, it is the heart not beating, or there's a brain death and there's a cardiac death. So we know physically what causes the death, but on a internal level or on a scriptural basis, when the soul leaves the body, that is what is death. So it is again added meaning to end of life issues. And then this is where understanding the concept of soul is important in understanding death for us as medical people. And that is a time when again most patients end of life need some questions answered. They will also question why the disease came to me, or why me, or what happens to me after death. So things like that. So again, understanding the Gita, understanding the principles of life and death will help you in your medical profession, and that's what it had done to me. And then the second thing that I would want to allude to from the Bhagavad Gita that has had an application for me is, again, we see a lot of suffering in our day-to-day lives. Of course, over time, we've become somewhat immune to it. But then again, you'll have to stop and ask, why is there so much suffering in this life? And it could be a medical illness, or it could be somebody, you're going on the road and somebody, is a very poor beggar, and somebody is, rich and he has this huge mansion that he can never tour his own mansion. So you will have questions like, why is this person born so poor? Why is that person rich? Or why is somebody so beautiful? Why is somebody so ugly? Why is somebody suffering from cancer? And even now we don't know. I mean, we've identified a few things about genes and environment for cancer, but do we really know why that person has that genes that cause the cancer? We don't know. So there are many questions that we cannot answer from a physical standpoint. And again, reading the Gita and reading the theory of karma, I've understood some of reasons why suffering happens. Of course, we cannot tell a suffering patient that this is why he is suffering, but our own understanding has improved based on the Bhagavad Gita. And the third concept, again, very important concept for me, has been understanding that we are not the doers. Again, in Bhagavad Gita, Krishna says that he is the doer of everything. And understanding that has really immensely helped me, because when actually I'll quote an incident. I was in US, and one of our maids' daughter had a heart problem. She had a valve that was stenotic or tight. And then they asked me for my opinion, and of course I was not in India, so it was a serious problem that needed an intervention, like a percutaneous intervention. And I referred them to one of the cardiologists that I know for that balloon procedure. And then that balloon procedure happened, and the patient actually died in that procedure. So I had this. I was very disturbed because the child would have probably lived longer hadn't I not recommended the procedure. So it was kind of bothering me a lot, because these questions come up. Did you take the right decision in sending that patient for intervention? Would the patient have been living longer? And what am I going to tell the parents and things like that? So it was bothering me. And then I was actually talking to my mentor that I alluded to before, and he was explaining to me based on the Bhagavad Gita that after all, we are not the doers. So if my intent was good in, sending that patient for the procedure, then, I don't have to take the blame on myself. Similarly, a lot of the times when, doctors achieve, good things, yes, skill is involved, but apart from skill, you need, the mercy of the God also, and you need, the appropriate time, the patience, karma, so everything comes. So I understood that, we are not the doers, and that is a very important shloka explains this. Karma ne vadikaraste ma phaleshu kadachana ma karma phala heturpur mate sangosta karmani. So Krishna in chapter 2, 47 verse, he says that, karma nevadikarasya means karma is your duty. So you perform your duty equipoised, means whatever is your duty, which again as doctors, my duty is to, take care of the patient. Do your duty and abandon all attachment to success or failure. So he says, ma phaleshu kadachana means phala means fruit. So whatever fruit means the result of the activity that you did, you let go, means you relinquish that ownership of that result, and then you offer that result to me. So Krishna here is saying that, you do your duty, whatever is your occupational duty. And then Gita, there's a lot of places where, Krishna talks about what your occupational duty is, and you do that without being attached to the result. So whether it is a negative result or positive results, you don't be attached to the result. And so whether the patient, does very well because you did a great procedure and you want to take the credit, that is also not okay. And if the patient dies and you've done your best, then don't take the, guilt of it. So this, I think, is a very, very important concept, and I do share it with, a lot of colleagues also, because on a day-to-day basis, we see this happen. Somebody dies and we are miserable because, we somehow think in our mind that, maybe we did something wrong, or just the guilt of, taking care of a patient that is, alive and kicking, and one fine day he's not there. So it's a lot of emotional distress also to doctors on a day-to-day basis. So once you detach yourself from the result of that activity or the procedure, then, you're less anxious. But at the same time, Krishna says, Mate sangosta karmani. Akarmani means just because you're not responsible for the result of the action, do not do inaction. Means he's not saying, sit in one corner because now you're saying everything that God is doing and you're not doing anything. Then why do I mean, lot of people ask this question. If the result is already determined by the Lord, then why do we need to do an action? No, Krishna very clearly here is saying you have to do your activity. So no one in this world can be, inactive. I mean, we all have to do some activity, either at home or work or anything. So whatever is your occupational duty, you do your duty to the best of your capacity. Now again, your capacity may be different from someone else's capacity. But once you've done that, then don't be attached to the result. So if the procedure is very successful, again, don't take too much credit for it. And if the procedure has failed, don't take, the guilt of it. So this has, on a practical aspect, really helped me, because we see this, back and forth. And so it allows you to remain very equipoised. And that's what the term Bhagavad Gita uses. So, dhira satrana mohyati means very, very dhira, means you stay equipoised. So these are like dualities that are going to happen in life. There will be success, there will be failure. And then take them very in a balanced fashion. Don't be, too happy or take too much credit for what you've done, and then don't feel very miserable or depressed when something goes wrong. So these are all, Krishna says, these dualities are a part of life and they're going to happen. So this probably, in a medical profession, this shloka 2.47 has helped me a great deal for understanding and dealing with these daily, and especially in pediatric cardiology, where we do interventions. It's a highly critical area. We do see quite a bit of death, and most patients come with, I would not say quite a bit of it, but these interventions are, risky. So we do risky procedures, and sometimes we handle very small babies. So that amount of risk is there, and that anxiety you have to, let go. Otherwise, it becomes very hard even to, do your activity. And then the other thing I learned from Gita is also that, you look at your duty as service. Krishna says, look at your occupational duty as a service to humanity, rather than, thinking that you're doing any great favor to anybody. So that is one more. And then again, reading Gita and understanding the spirit, soul, and that everybody is a part of Krishna has also given a lot of values. So it incorporates a lot of values in your day-to-day practice. So you've become, more compassionate. Again, compassion has to be a big aspect of your practice, A doctor that's not compassionate, could give magic drugs, but it's not going to help, and it's not going to, build that relationship. I think today what we are seeing, unfortunately, a lot of distrust in doctors and a lot of, violence, also very unfortunate, is creeping because of that, lack of that relationship. So there's a lot of misunderstanding between the doctor and the patient, and it comes from the fact that, you are busy, you're not taking time to, talk to the patient, not addressing the issues that, they have on mind, and most of all, I think, not being compassionate. Say, a patient comes suffering from diabetes. Nowadays, what happens again, there are a lot of reasons why, doctors are doing that, because, we have time constraints, we have money constraints, we have, corporate hospitals telling you to be productive, people telling you to practice medicine in such a way. So there's a lot of, I'm not saying that, we are doing anything wrong, but the situation is such that this is the situation. And I think being compassionate helps a lot of these problems that we are seeing nowadays. So if a person comes with diabetes, instead of, writing, glyburide and metformin and sending the patient in 2 minutes, spend some time, because that disease has implications on his life, on his heart, on his soul, on his family, on his future. So if you just spend, 5 minutes talking about them to the patient, just, hold his hand, make him feel that, you understand his pain, I think that goes a long way. And including me, so in a busy day, we are not able to do this. But from time to time, again, you have to stop and think, you have to practice medicine not as a body medicine, but a full person is coming to you, a person, who has a heart and a soul is coming to you. It's not just some, robot with a part that is not working. So I want you all to see, patient as a whole. So become a part of his life. Actually, I had a nice video. I don't have it today to share. I'll share about how, you have to see patients. They have so much going on in their lives that you may not be a part of everything, but take out that 5 minutes to, connect to that patient, and then this negative outcome will not happen. So these are, few points that Bhagavad Gita has helped me imbibe into my life. Thank you.
And these are some amazing concepts that you have shared, and I'm sure I wish that it can be shared to the medicos worldwide. I mean, it'll the whole face of the concept that we have about doctors and hospitals these days. A common man is scared. If they're afflicted by any disease, if you have to enter a hospital, they think twice, thrice. In fact, they avoid as much. And not to speak of the kind of trust they've been losing because of all the.
I think the problem is both sides. The patients are not understanding the doctor's side of the story, and the doctors are not understanding the patient's side of the story. I think it's a lot of miscommunication that's happening.
Yes, and in this scenario, if this whole concept of compassion, if that can be brought in, and I'm sure it can really help both the parties. And of course, the three concepts that you have shared with us that you have learned from Gita, in the second chapter, identifying the person as a soul, not just a robo with a part not functioning. That was powerful. And then how to see suffering and being equipoised amidst highs and lows. This is, I'm sure, the mantra for real success at the professional front for anybody. So thank you so much.
Yeah.
And I'm sure. And one last question as we are ending. Ma'am, what is your message to all the students here, especially to all the medical practitioners and not the practitioners, the medicos who are preparing for a future as doctors? Can you kindly address them and give your message?
Yeah. So, many messages I try to incorporate in this 1 hour of time with you. But to summarize, I think as doctors, we have a very important duty, I would say, to do, because you should see the body as a temple. Again, some of the acharyas say that, because why do you want to see body as a temple? Because it hosts, or the soul resides, right? The soul is a part of the God. So we have part of him residing in, every patient, and including us. So the body that is hosting the soul becomes a temple. So see the body as a temple, and when that there's a problem with the body, then you're going to try to fix the temple, right? So then you become the pujari. So that's how you should see it. So the pujari's job is very sacred. So when you are trying to fix a patient, your job is very sacred. Again, we've heard this, medical profession is noble, and people are trying to move away from it. There's a lot of business concept coming to it, and it's no longer a noble profession. Most people don't even consider it a noble profession. But I would say it's a sacred profession, because we need to. They've come to you for all this care. So see that body as a temple, and do your best. And so doctors have a very important job. We've been entrusted to do this job of taking care of the health of a person, and also make this healthcare very holistic. Again, if I want to give one message, would be make healthcare very holistic. Don't just limit it to the physical aspect of the disease. So try to provide for mind, body, and soul medicine. Even that concept is coming, but again, on a day-to-day, we are not practicing. I think try to make it that. And then compassion and empathy has to be a part of your healthcare to patients. And then one more I would say is do it as a service. So even though yes, we are going to be paid, and we are it's a job, and we all have to have money to take care of our family. It's a job, but when you do it, consider it as a service. Because they say when you help somebody, when you think you're helping a patient, then you see them as being weak. So you help somebody that is weak. And when you're seeing a patient that in your attitude is like you're fixing a patient, then you're saying that that patient is broken. So when you help somebody, you see him as weak. When you fix somebody, you see him as broken. But when you serve somebody, you see it as a whole. Okay. So then that becomes, that is why it should be seen as service, because then you're seeing that person as a whole. And then when you fix something or help somebody, then it becomes, a work on the platform of ego. But when you serve somebody, it becomes work on the platform of soul. So I think that's very important. Your approach should be like that. And then last thing I would say, again, a lot of commercialization is happening in medicine. But don't chase money. Money will come. So if you're a good doctor, you're doing all rightful practice with some of the concepts that I've told you, and be good in your academics and good in patient care, money will come. So I think we should not chase money, but see patient as a whole. Thank you very much.
Thank you, ma'am. That was such a beautiful summary of the entire session. The message, the take homes is that, as ma'am said, treat the body as a temple, yeah, and be the pujari within. Yes, and treat medicine as a holistic process, not just something, fragmental. And the two beautiful qualities that are the true embellishments for a doctor are compassion and empathy. Yes, and do not be materialistic in your goals. Do not chase after money and position. Do not serve the person rather than just kind of treat. So these are some really amazing concepts. I think, ma'am, it would be great if you can actually write some articles on this. I'm sure if you did have already written, kindly forward them. It has to be circulated, read and reread. It's not just once you hear and it's imbibed. I'm sure it has to be documented, or actually you can compile and write a book on this. It would help many. So thank you, ma'am. Thank you so much. I'm sure this whole talk show has helped many. Personally, it has inspired me so much to have a deeper insight into a profession and how well a profession can be balanced with the concepts of spirituality that we learn. So overall, it's been a great evening. Yeah, great morning for you. So thanks a lot. Does anybody have anything to share or add? Yes. Yes, Kritika Thakur.
Yes.
You have a
Hare
question?
Krishna.
Yes. Yes. question.
Yes, ma'am. So I wanted to ask, like, actually, doctors, when we are learning, we have to experiment and research on few bodies of animals. Like right now, I have not started. I'm just in school. I'm a teenager, but I have feared this. Like, I came into spirituality newly. I'm at my initial stage. So we have to research on few birds and all. We have to kill them and we have to observe them. So actually that is wrong if we see according to our shastras, because everyone has a soul in them, and that is again a part of the Paramatma. So how would you answer this? Like,
Yeah. No, you're right. Every living entity has a soul that's part of the Lord, and we don't have any right to, harm or kill any soul. But again, sometimes there's a higher principle and lower principle, and you'll sometimes have to make choices, even though so both may be wrong to a different degree. So, for example, I would say eating also non-vegetarian. Yes, we are killing the soul, but even plants have souls, right? So, because we can't survive without eating anything, so we choose to kill the plants rather than kill the animals, because the soul in animals is more highly evolved than the plants, and it causes less pain to the plant than the animal. And sometimes the plant regenerates or things like that. So when you're faced with choices of two things that are probably both are wrong, but one has a higher consequence than the other, then we may have to choose the one with the lower consequence, because we cannot live without eating. Similarly, disease has to have some solution and some treatment for the human beings, those of us so-called we are evolved. So in trying to help humanity, which again, helping humanity has to be seen in the context of having a higher purpose. Again, just not surviving and dying after 50-60 years without any purpose, then that is not by any means calling ourselves evolved. So when we say human beings are evolved and need to survive, that is when we are pursuing our goal, which is to realize the supreme God. So if you make that as your goal, then yes, your life has a deeper purpose, and you have things to do on the way. Then if that health needs to be maintained, then sacrificing a lower animal for that is probably, I would say, probably okay. I mean, again, choosing between the two wrongs, you may have to do this. So that is for even there's a lot of debate about the current vaccines. So vaccines also have some embryonic cells, they are saying, or some serum from other animals. So when you cannot avoid something that is essential for us, then yes, you ask for forgiveness and you may have to do that. So again, choosing what is lower principle versus higher principle. Hope that answers.
yes, ma'am. Thank you.
Any other questions?
Any other questions?
Pallavi, you can
Am I
probably
on?
share my email with them if they have questions in the future. I'd be happy to
Oh,
answer,
sure.
whether
Yes,
it's
yes,
yeah, even if they have a personal question or concern or anything that they don't want to share on this forum, that's fine too. I can do
definitely,
that.
definitely. Yes,
Yeah, somebody had a question, I think.
yes. Anybody else?
Oh, yes, ma'am. Actually, I only had another question also.
Okay.
So it was about like we are females, so according to our principles and all, we have to maintain some distance. But again, if we are in a profession of a doctor, then we have to deal with few other things that include the like that include maybe like touching few people, but that is not correct according to the shastras mainly. So what about that?
Yeah, see, Kritika, you have to take the Shastra in the context. Okay, they say, even Acharyas say that Shastra has to be interpreted in the context of time, place, and person. Okay, so something that has been, I'm not saying it's wrong or anything, but something that has been said in the Shastra in the past, if you're trying to apply it to the current time and context, sometimes it may not be applicable, because you've agreed that your occupational duty is to be a doctor, and the doctor's duty is to serve the patient or treat the patient. And if it entails touching the patient, that is okay, because again, this is a higher principle and that is lower. So as long as your consciousness is correct in doing it for the right intent for the patient, then it should be okay. So then you'll see a lot of these apparent contradictions you will come across in life, but always choose the higher principle and make sure your intent is right in all of these actions. Okay,
Okay, ma'am. Thank you. Thanks a lot. Actually, these two questions, answers which you gave, they were really helpful. Thanks a lot. Hare Krishna.
Hare Krishna.
That was very nice. Any more questions?
And one more
Perfect.
point I want to share in Gita, Krishna says, it's better to do your occupational duty even if you are not perfect at it, rather than doing somebody else's occupational duty. I just remember this. So that means, so everybody has, again, what is our duty is explained in various verses of Bhagavad Gita. So what is your duty? You should do it, even if you're imperfect, but don't, do somebody else's duty. So say, I'm a cardiologist. If I want to do gastroenterology, then that's not my duty. So even though I may know something, I should not know. This happens all the time, because nowadays everybody is a COVID expert. So everybody who is a surgeon wants to do COVID practice, a neurologist wants to do COVID practice. So I think that's not okay. So if I'm a pediatrician and a pediatric cardiologist, that's what I would want to do. So don't step on somebody else's duty, even though you're perfect. Krishna says, actually, even though you're perfect at it, don't do it. What is your occupational duty? You should do it. So again, when you become somebody's doctor, there's a patient doctor relationship. So you're supposed to do everything that patient needs. But if it is somebody else's patient, or somebody else's subject, then you're not obligated to do. So you should not think like everybody we have to fix everybody. That also should not be the concept. I'm saying particularly because of this COVID environment, where that border is not there anymore, and even non-doctors are treating COVID. So do whatever you're trained in, do your best, and leave what is not your field. I think we end up doing more harm than good.
I think it's a very interesting dimension of Shreyan Swadharmo Nidhana Paradharmo Bhayapa. I mean, this is a interesting purport to that. Okay, so fine. It was really wonderful, ma'am, having you in this show. I personally learned so many things, so many concepts, so many deeper understandings and insights. So I have benefited a lot, and I'm sure everyone on the show did benefit. They all have got a direction of vision and a lot of enrichment. So we are really, really grateful to you for your time and for your lovely association. Thank you very much from the core of our hearts for being
Thank you
on the
so
show.
much, Pallavi, for doing this. I've always also admired you for, taking up this challenging task of, training these youngsters. I think they all need it absolutely. And you're doing a wonderful job. And thank you for giving me the time to do this. And please, forgive me if I've said anything wrong by chance. So thank you all so much for, giving this Sunday evening time for me. Thank you.
Thank you very much, ma'am. Thanks a lot for your encouraging words. So have a great week ahead. See you all.
Thank you. See you all. Bye-bye. Thank you. Hare Krishna.
Hare Krishna.